everyone. Welcome back. I'm Dr. Ludmila Schaefer with the Doctor Connect show, where we are providing education and latest healthcare information through sharing stories and life experiences. Rate of medical knowledge increased dramatically for the last 3 to 5 years, and navigate through healthcare system is more complicated than ever. And today, I'm meeting with a Dr. Danielle Plummer to discuss on Hyperemesis gravidarum. Hyperemesis gravidarum is the medical term for severe nausea and vomiting during pregnancy. And we would love to share experiences of Dr. Plummer, and we will be right back. All right, Dr. Plummer, welcome, welcome, welcome. Thank you very much for joining us.
Thank you so much for having me on today. I absolutely appreciate this opportunity.
Before we start and learn more, so many unique experiences from you, can you please tell us your full name, where you're located, and then we'll start our conversation.
Absolutely. So I'm Dr. Danielle Plummer. I'm a pharmacist in Las Vegas, Nevada, and I work with women all around the world.
Excellent. And what exactly your story? Can you tell us a little bit background? And we would love just to learn about you.
Absolutely. So I'm actually a third generation pharmacist and grew up watching I was very young, but my grandfather had a store. My uncle took that over. And then as I was growing up, my father had a store I used to help out in when I was a teenager. And then my life took a whole nother journey. And I was an ice skater. I was a military spouse. I lived all over. And when I actually have a degree, my undergrad's hotel management. And that's what I was doing when I fell in love and first got pregnant and was just completely caught off guard by how sick I became at the time. And what I found out is now it's not taken like as a serious medical condition. They go, oh, it's pregnancy sickness. You'll be fine. It'll go away. But not only did it not go away, it got worse and worse and worse. And I was left with 9 months of malnourishment and dehydration and just suffering terribly. I lost my job because I couldn't work. And there's really no support, very little support out there for this. I did go on, I could tell the whole story another time, to have 2 more children spaced very, very far apart, and really thought each time I was prepared for what I was about to encounter. First time around, the doctor said to me, oh, it happened once, it might not happen again. It happened again. Third time was 4 years after the second one, and I had full coverage in healthcare, and I had friends and family to support me. I thought I knew what I was in for, and it was still just medication mishaps and a lot of suffering, inability to hold a job, and just hearing still from other women in my community, oh, it's normal. We all suffered that way. And I'm lucky today to have 3 healthy daughters who have grown into beautiful young ladies. But what I found now, it's been 20 years, and women are still suffering the same way. And I have to wonder why hyperemesis gravidarum is not treated as a serious medical condition.
And Dr. Plummer, can you tell us, for audience experience, a little bit more about Hyperemesis gravidarum? And I'm a medical oncologist, so I would love to hear from you as an expert, and also when it occurred, and maybe a little bit about it, what symptoms you watched, and what kind of first sign.
Absolutely. So the definition accepted around the world and by the Her Foundation, who spent 20 years researching and educating in this, says it's a potentially life-threatening pregnancy disease that may cause weight loss, malnutrition, dehydration, and debility due to severe nausea and vomiting, like you said. But the thing is, it may cause long-term health consequences for the mom and or the baby. What's really terrifying about this is that 1 in 3 pregnancies make it to term, either from miscarriage or from termination. And the ones I find who end up terminating wanted this pregnancy. So it's not that they went into this thinking, oh, I'm not sure, I don't know what to do. No, these are women who want to be pregnant. A lot of them will go through IVF first, but life changes are so altering and so mind-blowing that the suffering is so terrible that that decision is made, that they can't even keep that pregnancy. And that in itself leads to just decades of a lot of mental health issues. For the ones that do make it through, your bones suffer, your teeth suffer, your mental health a lot of times suffer. And it takes a lot of health and wellness in the long run to recover from that situation. During those 9 months, I'm an optimist. I could say it'll go away at 12 weeks, at 15 weeks, at 18 weeks. And like hormones, you know, they go on this wave, on this curve, and you might have days that are better. You might think some medications are working, but then not so much. And then you're back to where you started. And the isolation of it, the inability to socialize, the inability to, a lot of these women are at an age where they're growing their career, and all of a sudden their career has to take a back step to this. And that's where we can look at labs. We can look at how much weight have you lost. The parameter most doctors will go by is 10%. I lost 10% of my body weight that first trimester. I've met women who've lost 30, 40, 50, 60 pounds and then still aren't taken seriously. I've met women where doctors have told them it's all in their head, or want to get them help for weight loss disorders and eating disorders. And that's not what's going on. As an oncologist, you know, there's hormones involved. One of them that was recently discovered is not so recent to me, as I've gotten more deep into the research behind this, is GDF15, which I'm sure you're familiar with.
And these women have our audience, what is it?
Sure, it's a gene that secretes a hormone. It's a growth differentiation factor that makes it difficult to eat to keep food down. And it's interesting for other disease states like oncology, we know this is going to happen. We pre-medicate you before chemotherapy treatments. But when it comes to women who are pregnant, it's just like, oh, it's normal. You're pregnant, it's pregnancy sickness, it'll go away. But when you have an inability to hold a job because you are so sick, when you are left malnourished for month after month after month, that's when it becomes a disease that we need to treat as a serious medical condition.
And this is a very valid point, Dr. Plummer, and I would like to step back for a minute. So young women gets pregnant, and first experience, it's just like anything else in life. You know, you try to push through, you go through, it's unfamiliar. But what we are trying to do to also educate, of course, we learn from our own experiences and conclusions, myself, but also what it's a first time, you know, if you're young and first time, like you said, everyone tells you, oh, it's normal. And then you have to, you know, put up with everything else in life. And at this point, the first time, what maybe 3 tips or strategies you can tell our, you know, young women who are pregnant for the first pregnancy, and then we will go to the second, third. First, let's cover when someone experienced first time.
And this is such a great question, because this is what happened to me. And just yesterday, I was reading a post online, and a woman was saying, help, my sister needs help. She's 6 weeks along. So nobody thinks of 6 weeks along in a pregnancy as this could be a serious problem, right? So normally, as soon as you miss that period, you think, oh, I might be pregnant. I go do this pregnancy test, and it comes back positive. A little nausea and vomiting is said to be good, because that's giving that higher level of HCG, higher level of other hormones. We know we're going to have this protection for this, you know, this growing fetus. But at what point does it escalate out of control? And that's where that new mom, that first time mom, even the sequential pregnancies might go, when do I get help? Should I go to get help? Should I go to the ER? Now, in our medical society, and I think this holds true for around the world, you don't see an obstetrician or midwife until you're 10 weeks. If you wait until that 10-week visit, you're now 2 months, 2.5 months into a very malnourished state. You're malnourished at a time that optimal nutrition is so important. If you look online, you'll see pregnancy recipes, pregnancy nutrition, all these tips and helps to stay pregnant. We know folic acid is so important in preventing birth defects. Thiamine, I'm learning now, is just as important for developing so many parts in that growing fetus and for the own mom's health and wellness. And same with the other B vitamins. And so from there, it's like, okay, what is a mom to do at what point? My own rule of thumb, which a doctor once told me, was if you vomit for more than 24 hours, go for an IV. Now, the caveat there is if you go for an IV, whether you go to an emergency room, an infusion center, or a mobile health clinic, their odds are they're going to give you just normal saline. It's going to rehydrate you. They're going to send you home. And then 24 hours, you're back to where you started because that fluid's just going to go right through and dehydrate you again. So what's important is if you go through that time frame, you're vomiting for more than 24 hours, but you're also losing weight. You're also low on your electrolytes. That's your potassium, your magnesium, your sodium. You're also not getting your thiamine, your folic acid, your B vitamins in you. That's when you know you need more intervention. Now, a lot of women who come into pregnancy, maybe with a thyroid disorder, with diabetes, with mental health medications, really should have a full panel, a full discussion with their doctor, whether it's a midwife, an obstetrician, or a primary care doctor early on. I know in the US right now, it's really hard to get in to see a doctor because we're still dealing with this pandemic. So you don't want to delay care because of that. Your pregnancy isn't going to wait for the pandemic to pass. So that's where if you don't have a doctor that you can say, hey, should I be looking at my medications? Could something else be causing this? That's when you want to go get acute care and get a good foundation and not just get normal saline, but get these other treatments as well.
So, Dr. Plummer, the other that you brought a very valid point that in the United States, and yes, someone has access, but also healthcare disparities is really you right now. And in some it is just very difficult to access. If we look around the globe, you know, sometimes situation happen in some communities and someone might, be even pregnant without sort of knowing, let's say. And, even everywhere, I think healthcare disparities right now, really one of the most important. So someone who does not have immediate access to, let's say, emergency department, to the doctor, to intravenous fluids, is anything that, let's say, they can do for themselves. Maybe, of course, we urge for all audience, please follow with your doctor advice. And we are sharing experiences and conclusions. And information discussed on this platform does not substitute your medical care. But Dr. Plummer, what someone can do sort of for themselves advocate when we see some population that do not have access to healthcare directly?
And then it's a big challenge. Like I mentioned earlier, that I do have women reaching out around the world. There are lots of online resources. Be careful though, because there's a lot of things online that don't hold true. So be careful what you read and where you go. The foundation that I support is called the HER Foundation. And there's accurate, time-tested treatments that you can do there. But the first thing you want to do is get support from your loved ones, because the worst thing that you can do is suffer alone. It's very isolating. And when you lose those nutrients and you suddenly become weak, it's going to affect your mental health as well. And that's where you want to get your partner, whoever's with you through this pregnancy. If you have in-laws, if you have friends, if you have other family that can help out, that's that community. There's an old saying, it takes a village. And with Hyperemesis gravidarum, it takes the whole world. Because then once that you have that support from the community, what can you do for yourself? And that's where you need to, I think the first thing is get those electrolytes replenished. Try to limit the sugars, because sugars are going to deplete thiamine as well. So you want to look at electrolyte drinks. In the US, we have what's called Pedialyte. You think of children. It's not just for children. That's something if you can do ice pops, but again, not high sugar. For some reason, what happens in these bodies when we go through this is we crave these carbohydrates. They're not the best for us. We want to try to get some proteins, even if it's maybe small pieces of almonds. once you get deep into this, then you look at, well, what's easier that's going to come back up and not hurt my throat and my esophagus so much. But if you can catch this early on, you don't have access to care yet. It's really about getting the nutrients and getting the electrolytes, the vitamins back into your body to prevent this from escalating. Those little small sips of water. There's an old joke with hyperemesis survivors. Don't tell me about crackers and ginger because they're just not going to hold true. Start there. Absolutely. Start with all the morning sickness strategies that you see, keeping your stomach from getting empty completely, from preventing that acid from building up. If you have access to antacids, I can go into detail which ones I would recommend, which ones I don't. It's very patient specific. I feel oncology is the same way now. I know we're using genetics to treat oncology patients. Same thing with hyperemesis gravidarum. What works for you might not work for someone else, or it might. So it's a lot of trial and error. If you don't have access to care, that's where you need to try to maybe find a patient advocate that can help you. But just start at home with those little meals. Try to get higher protein and try to get those electrolytes in you. Once you fail those options, it is really important, though, to get medical intervention.
And it's very interesting that you mentioned about variety of electrolytes and how we have to balance our diet and our food and pay attention. But in addition, for the last 10, probably 20 years, we have so many new medications. And I could tell that started, medicine over 25 years ago. Pretty much in oncology, everyone was walking with a bucket, trash can actually, and vomiting. And right now, American Society of Oncology, and we have a quality improvement project. Pretty much, no one should have literally nausea from chemotherapy. It's of course it's kind of everything take with a little bit of consideration, but medication really increased, and the amount of different medication to treat nausea or do prophylaxis for nausea dramatically changed, and right now we control much better. Now in your field, let's step away from oncology. Did you know same in your field also, or that's kind of applicable to certain discipline?
We're decades behind. And one of the problems, again, it's that first trimester maternal care, I feel just doesn't exist. It's a gaping hole in our medical care. Now, for women who have a great first trimester, or that, like we said, that little bit of nausea and vomiting, they don't feel well, but that they can go back to work, they recover from it. That's fine. That's wonderful. This is for those women where that doesn't recover, where that doesn't happen. And because there's no FDA approval for medications for hyperemesis gravidarum, that they're all off label. It's the same antiemetics used in oncology, but they're off label. So doctors are very concerned then about using them in a pregnant woman, because now they're held liable if something happens to that mom. And there's a lot of studies out there that we talk about this international audience, women all around the world. In Europe, a study was published that I feel was very flawed, that related Zofran to birth defects. And if you dig deep into the study,
I'm going to interrupt you for a minute. Yeah. Zofran, for the audience, it's ondansetron.
Yes.
Okay, go ahead. Yes.
But because of the study, which again, I feel so they didn't even see, did the mom actually even take the medication? At what point did they take the medication? How much of the medication did we did? And all the other medications in the same class are category B. They're known to be not to cause birth defects. Well, a lot of doctors and a lot of pharmacists now are not allowing their pregnant moms to get access to this medication. So you really want to find a provider that can look at the big picture and say, this mom's considering termination. Wouldn't it be better to try ondansetron? Because we know it works in a lot of these moms. I love you have the Sancuso patch, which is granisetron. The pregnant moms don't know about this. OBs, midwives, again, if you even see them at, prior to the 10 weeks, 12 weeks later in the pregnancy, this is it's a patch. It's used in oncology. Why is it not being used in maternal health for these moms that are suffering terribly? I want to put that out too. I'm not working for any of these companies. I'm not promoting anything. I just want to let our audience know there's so many options out there, but you have to weigh your pros and cons, and you have to have these conversations with the doctor. The most important thing is that you don't suffer alone. You don't say this is normal pregnancy sickness. When you get to that point where you're losing weight, where your mental health is suffering and your financial health is suffering, that you reach out for help, because there are treatments for you.
And like you mentioned, for all audience, be your own advocate. Just like Dr. Plummer said, communicate. If you're not able to communicate with the provider, you can ask your family, friends, and reach out. But also, in addition, how is the audience can reach out to you, Dr. Plummer? We would love to hear how we can reach out to you.
Thank you so much. So I do, I have my own website called hgpharmacist.com. So for hyperemesis gravidarum, I have a Facebook group and an Instagram. Anyone who messages me, I'm going to message you right back. I'm going to make sure you get instant answers to your questions and the support that you need. I have, can I say my company? Just reach out to me, and I have a lot of freebies. I have a nice little guide right now on what to ask for in the emergency room, because you need more than normal saline. And Dr. Schaefer, Ludmila, this has just been an amazing honor. There's so much information. Don't suffer alone. Get your nutrients. There is a light at the end of the tunnel. So for anyone suffering at home, suffering alone, suffering terribly because of their pregnancy, please, 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 we're here to help you.
Thank you. Thank you very much. And everyone, please connect with Dr. Danielle Plummer. And of course, all information discussed on this platform does not substitute your medical care, but you will find so many valuable and amazing tools. We love having you. Thank you so much.
Thank you so much.
Excited, yes, to be for you on this journey with us. Thank you so much. And we will see you soon. I'm Dr. Ludmila Schaefer, and I level the playing field of knowledge around disease prevention, research, and patient care to help